and obviously, as you get older, you have tests on your heart and everything, and that plays a role. But we mentioned this before. There is no sort of brain scan, is there, of a preventive measure?
So you can get imaging, but it's not going to really be able to assess your risk as such. What you can do is there's apps even you can download from the web. There's a whole series of them, and what they will do is you'll input your data. So you'll input your blood pressure, your cholesterol level, your sugars, your age, and things like that.
And it will tell you horrifying result.
And it will tell you. This is great because it will tell you what your risk is on 5-10 years and what your risk is if you had those modifiable factors well controlled. Which is the gap that you can do on.
That you can actually take action on.
Exactly.
Despite all of this, though, there are times where something just happens.
Correct. I mean, the body ages, there's wear and tear, and things can happen, even if you do everything right.
I want to ask you, for people who were athletic younger, and because we hear a lot about concussion and concussion protocols today, are people who played sports and had concussions more susceptible to strokes?
Well, trauma can increase the risk of bleeding. So you can have injuries to the blood vessels, you can have tearing and those sorts of things. So that can increase your risk of stroke. But it doesn't really play a major factor for stroke as the other things do. But yeah, it's something to take into account for sure.